I'm going to do some hand hygiene before I go and look at my physician's orders for the day. So I'm going to check the orders. So my patient on the physician's order says it's Bob Sweetheart. He's 72 years old. He came in here for pneumonia, and his allergies are for sulfa and shellfish, so I'll make sure to pay attention to that with looking at the medication. So he's going to be getting sodium chloride 0.9% at 75 milliliters per hour, and through IV, a primary. And then his piggyback is going to be Zosyn, 3.375 grams and 100 milliliters, to be infused over 4 hours every 8 hours. Okay, and I'm checking this on the MAR as well. Okay, same patient, Bob Sweetheart, 72 years old, same allergies. And I see the sodium chloride, same 75 milliliters per hour. So, and then 0.9%. The Zosyn is 3.375 grams and 100 milliliters. Infused over 4 hours, so let me take it out. Okay, and I'm also going to gather my primary and secondary tubing. Okay, I'm going to compare these to the physician's orders as well. I'm going to start with the Zosyn. First, I'm going to check the bag for clarity to make sure it's clear, not cloudy, and that there's no tears or rips. And so I'm also going to check the expiration date, January 15th, 2020. Good. And then it's Zosyn. On the label it says it's 3.375 grams. And that it's to be infused 4 hours every 8 hours. Perfect. Same patient's name on the top as well. That's Bob Sweetheart. Okay. Also going to open this up. Check our fluid. So this is sodium chloride, and it's 0.9%. The expiration date is also January 15th, 2020, and it's 500 milliliters. Good for all the order. Sweetheart, awesome. And I'm also going to check for clarity, if it's cloudy, and if there's any tears or rips or leaks. Awesome. So every time you want to look at medication, I'm going to look it up on my Skyscape ahead of time before going to the patient's room, and I see that Zosyn is an antibiotic, and I'm also going to look at the flow rate and calculate that. So it says to be infused over 4 hours. It's a 100 milliliter bag every 8 hours, so 100 milliliters for over 4 hours is 25 milliliters per hour. That's the flow rate. And so I checked to make sure this is all the right information on my drug book or on my Skyscape, and it looks like it's okay. So now I'm going to take all my supplies into the patient room with my physician's order, and I'm going to start to prepare it in there. We cut it. So before I also go in, I also want to check with my drug book that both solutions are compatible to be used with a piggyback. I'm going to knock on my patient's room. Hello, Mr. Sweetheart. I'm Kara. I'm your nurse today. I'm going to provide privacy as I place my stuff. Can I please ask your name? Okay, Bob Sweetheart, and your date of birth? Thank you. How are you doing this morning? Good. I'm also going to check your IV site because I'm going to be adding some fluids as well as I'm going to be giving your antibiotics today. Have you heard of Zosyn before? Yeah. Well, it's for your pneumonia. It's an antibiotic, and some of the side effects are diarrhea and also a rash. So please let me know if any of those happen with your colli right here. I'm checking your IV to make sure that it isn't extravasated or infiltrated. There's in the patency. I'm gonna feel the temperature, make sure it's not warm. Check for redness, swelling. If you do find any of that, please let me know as soon as possible. Okay, I'm gonna start preparing your IV fluid, so just let me know if you have any questions. I'm gonna gather my supplies. Oh, I just wanted to confirm your allergies. What are they? Okay, sulfa and shellfish. Okay, so I looked on my drug guide ahead of time and I found that none of these have any sulfa in them, and shellfish is not also obviously present on that. So I'm going to take my primary tubing out. Okay. Gonna make sure the tubing's really nice. There's nothing, no breaks in it. I'm gonna make sure it's in the locked position as well, that the cap is on for the spike. Before I start to prime the bag. Okay. I'm gonna put my bag up here. First, I'm starting with the sodium chloride because it's our primary bag. I'm gonna pull off the tab. Okay. And this is a sterile procedure, so when I uncap the cap, I'm gonna make sure nothing touches it. Okay. And I'm gonna spike the bag. I'm gonna do a twisting motion. Make sure the spike is fully inserted. Into the bag. Okay. I'm gonna fill up the dripper halfway. Okay. I'm gonna prime the tubing, making sure I get all the air bubbles out. I'm gonna slowly do this. See it flowing through. Checking for air bubbles, making sure it's all nice. Okay. Close the clamp. Make sure there's no air bubbles in the tubing. Okay, if there was air bubbles, I would do a flicking motion until they came out. Okay. So now, cut it real quick. I'm going to do my final check in the patient's room before I plug it into the patient. That this indeed with the MAR is for Bob Sweetheart. And we have a Zosyn, 3.375 grams. And we have the sodium chloride. And that will be for 75 milliliters per hour, and it's 500 milliliters. Perfect. Okay. So I'm going to make sure my tubing is fed into the line. I'm going to make sure it's plugged into the patient, since it's the primary, into the IV site. Okay. Now I'm going to set up the Zosyn and the secondary tubing. Get that out. Make sure all the tubing is nice. No rips. I'm going to lock the tubing. Okay. Pull out. There we go. And I'm going to spike this tubing. Okay. Hang the bag. I'm going to make sure that this primary bag is lower than the Zosyn because of gravity, we make sure the piggyback is higher. Here we go. I'm going to fill up the drip chamber halfway. Okay. Then I'm going to slowly prime the tubing. Okay, if there's any air bubbles, I'm going to flick them to get them up the tubing. Okay. Now I'm going to connect this tubing to the primary port. This is another sterile procedure, so I'm going to make sure that I wipe the port completely and let it air dry. Okay, now it has to air dry. Okay, now that's air dried. I'm going to take off this cap. And I'm going to connect the port to the new secondary tubing. There we go. Okay, now that they're connected, I'm going to set up the flow rates. Now, based on my MAR, and what I calculated in the drug book, okay. Okay, so this primary has orders to be at 75 milliliters per hour. I'm going to set that to 75 and make sure that the volume to be delivered is 500. Now with the piggyback, this one is to be 25 milliliters per hour. It's already at 25. And then I'm going to make sure that this one is at 100 volume. Okay. Now that that is set, I'm going to make sure all my lines, well, I'm going to run it and then make sure all my lines are open. Okay. Gonna check to make sure it's dripping. Check all the there we go. There's a drip now, so we know that the IV is infusing. Okay. Hello, Mr. Sweetheart. So I have set up your IV. If you feel any heat on the IV site, if you're feeling itchy, that could be an allergy, so please let me know as soon as possible. Your colleague's right next to you. Do you need anything before I leave? Are you comfortable? Okay, great. I'm going to wash my hands once again, and then I'm going to document using the medication, the date, and time with my initials. And I'm also going to put a label on the tubing so that they know when that was given. Then I'm also going to put the location of my IV. And then I'm going to clean up all my supplies, and then I'm going to be done.